let's be honest here. We all want to look younger, don't we?
Some of us more than others. So today we've asked Dr. Bradley Bengtson to come in today to talk about some great options for men and women. And you know, you think about spring, it's definitely spring fever in the air. And what better place to start with a new, fresh face, right?
Absolutely. First of all, it's great to see both of you here together.
Yeah,
it's been a while
great to see you
I know.
again.
since that's happened.
We've gone a little bit.
Yeah,
but
for sure. But yeah, it is. It's kind of a time of renewal, right, and refreshing. And since we're all about facial restoration, all the things that we do and I do personally, surgically, as well as our practice, is very restorative. We want to make a younger you, but not a different you, right? So I think the best plastic surgery is someone who you can't tell has had plastic surgery, right? So it's very natural, restored, sort of a look.
I think that's a lot of people's fear. They
It
don't
is.
want to be altered in any way. And one of the really easy things to do is a filler that's extremely popular for you. And it's actually something I got to try previously before I was pregnant with my latest daughter. And it was a really cool experience. And it was painless, relaxing, and the results were great. This was you giving me Botox.
Oh yeah? Okay, cool. Yeah, I do remember that. Yeah.
What is
You
that
didn't
like and
scream
what
or
does it
yell
do?
or hit or anything.
No,
It was
no.
really good,
It was a
yeah.
positive experience.
Wonderful.
Yeah. So we're working on ways to actually deliver these different techniques completely painlessly. And we want it to be obviously as great of an experience for the patients as possible. And so when a patient comes in, we look at their face kind of three-dimensionally to assess what their concerns are, and then kind of match up the best skincare program, because our skin and condition really shows the brightness of our skin. And then we evaluate the wrinkle lines, and that's usually Botox filler. And then the surgical aspects are just more structurally with the face, because as we age, we lose volume, and then we start to gravitationally get a little saggy in our cheeks and neck. So.
And there's no real age cutoff because we all age differently, right?
Right.
Part of that's genetics.
Right. Sometimes you'll see a 60-year-old 90-year-old or a 90-year-old 60-year-old.
Yeah.
So it's all about kind of bringing out the youth and how patients feel on the inside.
One of the things in having you do this for me that was very comforting is that you have really reached a status as a Botox provider that very few plastic surgeons have reached. Why don't you tell us about that?
Yeah, so it's a real honor. We're very involved with Botox fillers. Like a lot of patients are very surprised in Grand Rapids, Michigan, the volume and the quality of physicians and plastic surgery, kind of providers. So we are at Black Diamond status. So Black Diamond is less than 1% of all plastic surgery practices in the United States. So there are about 40 or so practices, and then particularly for a solo practitioner to be, Black Diamond providers, it's very, very unique. And we also, I'm one of 2 plastic surgery board-certified plastic surgeons that are actually trainers of these materials. So we'll instruct and train different physicians and nurses and PAs and stuff on the techniques. So.
Which is really great. And then we talk about kind of going to that next step where some people go through the route of the Botox, some of the other fillers, but then you get to a point where sometimes you do decide to move forward with surgery on some of those more difficult areas.
Yeah, how I kind of position skincare and Botox fillers in, it's really interesting. We're kind of an either-or society. It's like we're either surgical or we're either non-surgical. Actually, I think most commonly it's both and, because a lot of the fillers and obviously the skincare really affects different areas of the face that surgery just can't get to. So it's a huge adjunct for the surgical patients, but also for patients that are not quite ready for surgery. But when, again, you start getting really significant volume loss in the face or extra jowling or extra neck skin, there's no external means or tightening systems that will really, do the job. So really that's more of a surgical approach. And
we have
really,
a picture here that kind of demonstrates a before and after and the difference that can be made.
Yeah.
You look like you've shaved 20 years off this person.
It's really impressive what can happen. So we've kind of modified our approach. First of all, we brought in some liposuction techniques where we put fluid in that virtually eliminates the bleeding. So the first facelift I did 20 or so years ago may have taken about 7 hours. Now it's really down to about 2. Wow. And so it's just much more efficient and really no bleeding. Patients have very, very minimal swelling, sometimes a little spot bleeding. We modified our incisions to really hide the incisions kind of up in the hairline, beneath the sideburn, actually inside the ear, so there's no tip-off incision in front. And it's really doing more than just a skin, sort of thing that you see on television kind of advertised. It really is a full-blown facelift, but through a shorter scar. And then if we need to take care of more neck, like the patient that was shown, we need to kind of continue the incision down. Sometimes we'll get 2 inches or more off each side of the neck. I mean, there's that much extra skin.
Yeah.
And that's where you sometimes can really see someone aging, where maybe they've protected their face for all these years, but it's really in that neck area. You can notice that a great opportunity to shave many, many years off someone's appearance.
I think it's the neck and the eyes really is the main thing that really shows our aging over time.
Yeah.
So.
Well, you have a great event coming up, and so we want to tell folks about that because you're offering some prices that are just out of this world. Wednesday and Thursday, you're going to want to call because these appointments are really, really getting sucked up fast.
I was talking with Terry earlier. I think we're actually almost full, so we are going to extend, the days and the offer to accommodate whoever calls, especially all the AUS viewers, right?
Of course, $10 a unit for Botox. So we have a $50 instant rebate on the purchase of $200 in Botox, Juvederm, also 25% off skincare facials. That's really generous. And so a lot of people looking to put their best face forward for spring, and perhaps talk about some of those other options that they have, because you can look and say, okay, this is what I think would look best or work best for you.
Exactly, and I feel really blessed to have just an incredible, talented staff. They're just fantastic, and like with the skin, we have this brand new silk peel dermal infusion system. So it's like a microderm on steroids. So basically it does microdermabrasion, but it also infuses different chemicals like vitamin C, Lumixal, which is a brightening agent, into the skin to really clear the skin, give you that really, really fresh glow. It actually plumps the tissues in the lips, so a lot of the actors and actresses before the Oscars will actually have a treatment just a few hours before they go actually out. So, yeah, it's really neat.
Well, thank you so much. A lot of great information to share with our viewers, and again, make sure you call today to set up your appointment because the appointment times are going fast.
Yes. Stay with us. We'll be right back.